afternoon. Today I'd like to talk with our fellow Washingtonians about our new efforts against the COVID-19 virus. Unfortunately, I have to report that we are experiencing an uptick in the COVID-19 virus activity in our state. And we know that if we are going to stop the spread of this virus, we need to remain vigilant and diligent and resourceful. As John Bell Edwards said, he's the governor of Louisiana, we may think that we're done with the virus, but the virus is not done with us. And I would like to share some information with you about why that unfortunately is true in the state of Washington. We're looking at a graph here, and this graph basically shows the R0 number. That's the number of how many people are infected when one person becomes infected. And this is produced by the Institute for Disease Modeling. It's a very accomplished group. We're briefed by them essentially every week. They do a very sophisticated analysis looking at all of the metrics that go into really figuring out what's going on with this virus. And you'll see that at the beginning, people who had the disease infected close to 3 people for every person that was infected. And when that happens, of course, the number of people who are infected explode exponentially. We drove that number down dramatically as you see the curve go down as the time goes on to the right on the horizontal axis. And we did that because Washingtonians were committed and disciplined and caring for one another when we did our social distancing. Now, it was very painful for us because we had to shut some of our businesses in order to maintain social distancing. As we have reopened our economy, that social distancing strategy has not been available to us as we become closer to one another as we are reopening our economy. As a result, what we are seeing is that the number of people that one person infects is now going up. And you'll see in this chart that's indicated in the far right of the screen, the red line is the R0 number, the number of people that are infected per person who are infected. For Eastern Washington, the purple line is for Western Washington. You'll see that it is worse. It is a steeper curve in Eastern Washington. But in both cases, these lines currently in Washington are in the red zone. They're in the danger zone. And that is that they are over the number 1. And you'll see a horizontal line that both of these lines have crossed. That's the safety zone. And if you're below that line, fewer than 1 people become affected. If you're above that line, more than 1 people become affected. And when that happens, the virus spreads and increases its damage in the state of Washington. So unfortunately, I have to share with you that even though we have been resourceful and committed, as we have reopened our economy, as we have shedded some of our social distancing, we are now experiencing a higher activity of our virus. Now, is this just a hypothetical concern? Unfortunately, it is not. I want to share with you how bad this is and could become in the state of Washington. In Yakima County, which is the epicenter for this virus in the state of Washington, the healthcare system, because of COVID-19 infections, is so stressed that there is no room at the hospital in Yakima County. Repeat, there are no rooms available to people for this treatment in Yakima County. That means that patients are having to be shipped by ambulance outside of Yakima County to Seattle and other places. And it is so challenging that now we are going to have to engage a different service to transport patients out of their home county to get treatment. There's no room in the hospitals. This is something that we saw in New York. It's something we saw in Italy. It's something we're seeing in Yakima County today, and we do not want to see that condition spread across the state of Washington. So today we are adopting an additional and new strategy regarding the use of facial coverings in the state of Washington. We've seen people do that already in Yakima County. Only about a third of people were wearing facial coverings a couple weeks ago, but just this last weekend, that's risen to about 60%. This is encouraging. It shows that we can adopt measures that can actually reduce the transmission rate of this virus. But we know that this issue is much bigger than Yakima County. So that is why today I'm joined by Secretary of Health John Weisman, who's signing a public health order mandating the use of facial coverings across the state of Washington. It will take effect this Friday, June 26th. As we know, willful violation of this order is tantamount to a misdemeanor. Now, as necessary economic activity increases and more people are out in their communities, it is imperative that we adopt further measures to protect us all. I think this is the way we need to look at this. We just cannot wish this virus to go away. We have to use tools that are available to us that we know that work. And we know that social distancing worked. That's why when we reduced our business activity and had the painful experience of closing our shops, the infection rate went down, and that worked. But that's a tool we've now put aside and want to put aside as we are reopening our economy. It's sort of like turning a screw. We want to turn this screw down and screw this virus down. But that's a tool we'd like to put aside so that we can reopen our businesses across the state of Washington. But we have to replace that tool with something. And what we have available to us is a face masking way of doing business that we know works and we know people around the globe are now using. So tomorrow I also will be signing a proclamation specific to Yakima County that also requires businesses to require their customers to use facial coverings and does not permit those businesses to operate if they are letting their customers, selling products or services to their customers without facial coverings. Now, as far as the facial coverings we're talking about, it's everybody's style is acceptable. Any facial covering that can cover the nose and mouth will do in this case. Some are more effective than others, but we've seen evidence that they all help. And so what you choose is your choice. And we're just appreciative if everybody can think of this as a new part of the etiquette in our state. I think of these face coverings in some sense as a statement. It's a statement that when you wear it, it means you care about people, because it means you want to reduce the risk that you are going to infect another person. Now, nobody intentionally wants to do that, obviously. The problem is that we just don't know when we self have the virus. There's nothing frequently to indicate we have the virus, even though we're transmitting the virus. So when we go to the grocery store and we're feeling chipper and it's a sunny day and there's no problems, we may have the virus. We may be spreading it silently to people we've never met before or to our loved ones. When we wear a face mask, it is a statement that we care about other people enough to protect them from that potential virus. That's why it's so important, and that's why I hope people are now broadly join this effort. So in Yakima County, there will be a requirement regarding businesses, and we're going to move forward in the entire state. Now, when are these required? This means when you're in a public place for work or errands or entertainment. Inside, you're legally required to cover your face in most circumstances, and that's for the health of your neighbors and your community. If you're alone outdoors, that's okay as long as you're in a position where you can actually maintain social distance. But if you're at a bus stop, for instance, and you're shoulder to shoulder packing tight, even though you're outdoors, ought to put on a mask, because that'll help people. You get out of the car in a parking lot, you go into a store, you want to go into the bookstore, pop on the face mask. I think this is something we can get used to because we do care about people around us. Now, there are exceptions to this. I'll touch on those in a moment. But I do want to talk about why face coverings, and we'll have more of a scientific explanation of this, but suffice it to say that a large body of studies support the use of face coverings to reduce the spread of COVID-19, while simultaneously allowing us to increase our activities. So until a vaccine or a cure is developed, this really is going to be our best defense. Now, fortunately, we have something that's not expensive, readily available, allows us to do our business and enjoy ourselves, that actually can save people's lives, and it's available to all of us. But that's only if our leaders in elected office and their communities are unified and engaged on this. This is something where we can all be leaders. You don't have to be in elected office to be a leader on this. And it is important that we all lend a hand here, because if only 30% of us do this, we're not going to have the requisite protection in our community that we need to break this chain of transmission. I also note that masks cannot do this alone. We know we need to follow our previous health guidance, like physical distancing. It means that we've got to still wash our hands. It means that when we do our contact tracing, if you are positive and you get a call to help us find other people who may have been affected, it means that when we are asked to isolate, that we isolate so we don't affect other people. All of those things are still extremely important. But the one missing piece right now is this face mask, a strategy that is available to us. There are exemptions. Exemptions for those whose health might be adversely impacted by a face covering if there's respiratory problems. For those who are deaf or hard of hearing, specifically in instances when they're actively communicating. Children under the age of 5 are not required under this mandate. And by the way, the health officials are saying children really should not wear these under the age of 2. And from 2 to 5, it's recommended that if that's possible, we hope parents will do it. But the requirement does not start till age 5. Obviously, there's times where it's appropriate to remove the face coverings, even in public. That might be required in some recreation. It might be, obviously, it's required when eating in a restaurant. So that's not an exhaustive list. We obviously got to use our common sense.